So now let's look at the ACSM recommendations for exercise training in COPD. Let's look at our FITT in COPD. This is right out of the new edition of the guidelines. So just like anybody else, frequency at least 3 to 5 days a week. So that's our minimum for health-related fitness. So, intensity. So alternating vigorous and light tend to recommend it. So if they, lighter intensity training and, trying to get them to be physically active, but it's the higher intensities that really elicits the physiological improvements. So, basically what these folks have to do is they have to really try to work at more moderate intensities. You may actually give them a dyspnea scale, and looking at the modified Borg scale, the 0 to 10 scale, 4 to 6. So still we're looking at maybe 11 to 13 on the 6 to 20 scale. The problem with a lot of folks with COPD is they often are not able to do the amount of time that they can do. So they're probably going to have to do intermittent exercise, so sporadic training, so get them to a higher heart rate and then let them rest. So a workout that would take us, say, 30 minutes to do is going to take them 2 to 3 times as long because of the amount of rest intervals that they're going to have to do. Looking at resistance training, and resistance training is definitely recommended. They can follow the ACSM guidelines. The major reason is because if they can improve their muscle strength and endurance in their extremities, it's not going to be as much of a stress on their lungs. So, but they should be able to follow the same recommendations for regular adults or healthy adults or older adults. And neuromotor training, don't forget about that for older adults. Inspiratory muscle training. So inspiratory muscle training, it can lessen the dyspnea and improve someone's exercise tolerance. And I've got a video on the link showing some inspiratory muscle training. So people will use these little devices that they hold in their mouth, and it helps them work on their inspiratory muscles. So they can look at, pressure, they can work on a resistance, and that there's no real type that's one better than the other, but getting people to use these inspiratory muscle trainers. And I don't know if any of the endurance athletes in the class have ever used them, but they can also benefit endurance athletes as well. So 30 minutes a day, so that's a lot, or 2 15-minute sessions a day, 4 to 5 days a week frequency, intensity, a minimum of 30%. And the type of devices, you can get an idea. They all kind of look the same. It's difficult to tell one versus the other, but they are a handheld device. So now let's move on to CRPD, so restrictive, chronic restrictive lung disease. So obstructive means that air can't get out. Restrictive is that the lungs cannot expand normally, or the lungs are replaced by some sort of fibrous tissue which restricts the lung volume and the tidal volume. So most of these diseases that are considered CRPD, diseases that affect the thorax, respiratory muscles, nerves, the pleura or the parenchyma, which is the lung tissue itself. So we'll talk about some of these in more detail throughout the course of the semester, but neuromuscular diseases such as muscular dystrophy, spinal cord injuries, so anything that's going to affect the nerves, the lungs are not going to be able to do their normal type of work. People who have disorders of the chest wall, scoliosis, ankylosing spondylitis, that is a type of arthritis that causes an abnormal curvature of the spine, and it looks somewhat like kyphosis, and we've talked about kyphosis before. Pulmonary fibrosis is a disease where the lungs get replaced with fibrotic tissue. We just recently had 9/11, and 9/11 rescue workers are at very much increased risk of pulmonary fibrosis from all the different chemicals that they were exposed to. Cancer, obviously lung cancer is going to reduce the lung volume, and pulmonary edema, so excess fluid buildup in the lungs.